Hey everyone, I'm Allison Morris. You're watching NBC News Now. The Biden administration launching a coast-to-coast push to promote the American Rescue Plan. President Biden spoke at the White House this afternoon while Vice President Kamala Harris is in Las Vegas thanking workers at a vaccine clinic.
You guys are saving lives. You are helping people, some who you may never meet, but because they know what you're doing, they're inspired to trust and believe in our healthcare professionals. And you all are sacrificing and have been for a whole year.
Today, the U.S. is closing in on 30 million coronavirus cases and almost 538,000 deaths. At least 38 million Americans now fully vaccinated, more than 135 million shots administered. In Florida, people 60 and older are now eligible for the vaccine. The challenge from here on out, convincing them to get it. President Biden, GOP leaders, and public health officials all trying to persuade skeptical Republicans to get the vaccine. We'll have more on that in just a bit. But we begin this hour with the American Rescue Plan Roadshow. We have team coverage with NBC News White House correspondent Carol Lee and NBC News reporter Deepa Shivaram in Las Vegas. Carol, we'll start with you. President Biden talked about learning from the past to make sure the money in his relief plan goes where it's supposed to go. What was his message for small businesses today?
Well, broadly speaking, Allison, his message is help is on the way. That's how the administration is branding this blitz across the country of what they're saying is an education campaign to try to make sure that Americans know what, in their view, are the benefits of this bill. So we heard the president say that this is something that it's one thing to pass the bill like this, but it's entirely different when it comes to implementing something as massive as a $1.9 trillion outline of proposals that go to all different types of things like small businesses, as you said, vaccination, schools, state and local governments, individual Americans. And he also announced that he has named somebody as the point person to oversee what he said is making sure that every dollar is accurately spent. And that's Gene Sperling, who's a former Obama administration economic official. He's well known in Democratic circles among economists, and he's somebody that the president is familiar with. And the president essentially saying that they're trying to learn lessons from the early days of the Obama administration when they were implementing the stimulus plan, which was smaller than this. Take a listen to what he had to say.
I learned from my experience implementing the Recovery Act just how important it is to have someone who can manage all the moving parts with efficiency, speed, and integrity and accountability. And together, we're going to make sure that the benefits of the American Rescue Plan go out quickly and directly to the American people where they belong.
Now, there are a few people who know better, Allison, than Joe Biden what it takes to see through an implementation of a bill like this, because he was appointed by then President Obama to do just that. So he's speaking from a point of personal experience here.
Deepa, Vice President Harris is in Las Vegas for the West Coast part of this Help Is Here tour. That city has lost a ton of tourism revenue during the pandemic. What is the VP doing there today?
Hey there, Allison. So Kamala Harris, a full day here in Las Vegas, landing a little before noon, and she made a couple of stops, first going to a vaccination clinic and center at the University of Las Vegas here, thanking the workers for, making sure that people get those shots in their arms. Of course, a big priority for this administration. She visited a small business, got some lunch there, and she also stopped by the Culinary Academy of Las Vegas, which is where a lot of these union workers, these service workers, get trained and retrained to get those skills to do their job. Like you said, this city hit extremely hard by the economic impacts of the pandemic. Unemployment, Allison, last April was about 30%, and the tourism rate is down still about 60% from where it was 1 year ago. And so the fallout from that is, of course, all these workers who are, looking at these government checks, thankful for that money coming in, but whether or not it's really going to last them as a long-term solution is what we were talking to folks about here this weekend.
I love my job. I'm not a lazy person. I appreciate the help from the government. Don't get me wrong. Like what I said, little thing helps. I really appreciate, but those are short term. Those are not long term. My kid's life is a long term. Just give us a chance to go back to work, you know?
So you hear there, Allison, that was Mary Ann. She is a former buffet worker at the Strat Hotel and Casino. And she called this bill, this package, those checks coming in, a short-term solution. And other workers called it a Band-Aid solution. It really is not their long-term. What they want is their jobs back. They want that permanency. They want that steady income. And so while there are a lot of pieces of hope in this stimulus bill that came through, there's still a very long road to recovery ahead in a city like Las Vegas. Allison?
Deepa, I know you also spoke with county leaders about a, quote, new normal for Las Vegas. What do they think that might look like?
Yeah, that's a really interesting aspect of all of this, right? Like, you know, we're going to come back to normal at some point. People will get vaccinated. Businesses will start opening back up. But what that norm looks like is not going to be the same as what these local economy leaders and community leaders are telling me. And what that means is a very different change in how technology is a part of service work. You can tell, I mean, even when you've gone to a restaurant, right, during this pandemic, you might have ordered your food at a table from a QR code rather than someone coming over and taking your order themselves. And so it is a changing workforce, and some of those skills that workers have are going to have to change. They might have to be retrained for some of these jobs. And that's actually something that Kamala Harris spoke about when she was just at that culinary academy a few minutes ago. She was speaking about some of the skills that they can use to retrain workers. It might be more coding rather than some of the service work that we're used to. So as we shift towards opening back up cities like Las Vegas, there is going to be a lot of changes for these workers, which only adds to the anxiety that's going on all over the place.
Carol, President Biden's heading to Pennsylvania for the first time as president. He'll be in Delaware County tomorrow. What are you expecting from him there?
Well, Allison, tomorrow he's going to really focus on the small business benefits that the White House wants to highlight in this COVID relief bill. So he'll go to Delaware County. It's right outside of Philadelphia area, a suburb there, and he'll highlight that aspect of the bill. And what you can see in this plan that the administration has outlined, where they have the first lady, the second gentleman, the vice president crisscrossing the country, they're highlighting different pieces of this. So the first lady's touching on schools. We've seen their focus on vaccination sites, and now as well as small businesses. And that's where the president's focus will be. And according to White House Press Secretary Jen Psaki, he'll focus specifically on the benefits in this bill for minority-owned businesses. But if you step back and just look broadly at what they're doing, they're trying to maintain the momentum and support that this bill has. And the reason they need to do that is because what we've already seen is Republicans who didn't support this bill are coming in and are essentially going to pick this apart. And no one knows better than Joe Biden, because of his experience in 2009, that when you have a bill this large, there's going to be something that they're going to be able to find in terms of criticisms and maybe potential waste or abuse of various funds that are supposed to go in certain places. And so they're trying to get ahead of that here. And that's why you'll see the president out tomorrow talking about the benefits for small businesses. And then this tour will wrap up with the president and vice president appearing together in Atlanta.
All right, Carol and Deepa, thank you both for being with us today. Vaccine holdouts could stand in the way of defeating this pandemic. Among the biggest skeptics, Republicans. 41% of Republicans and 47% of Trump voters will not get the vaccine if it's available to them, according to a new NPR Marist poll. NBC News reporter Alex Seitz-Wald joins me now. Alex, you spoke with some scientists who say this could be a deal breaker for the U.S. when it comes to reaching herd immunity. What are the biggest challenges in persuading these Republicans to get the vaccine?
Yeah, that's right, Allison. So the problem here is that, the vaccine hesitancy has been around since as long as there have been vaccines, but it's typically been a fringe issue, and it hasn't really had a politics. You've had people on the left who want all natural lifestyle, and you've had people on the right who are kind of get the government off my back crowd. The difference now is that this pandemic has been polarized along partisan lines from the very beginning. Republicans have been more resistant to wearing masks, to social distancing, to lockdown orders, and that is now extending to the vaccine. As one expert I talked to said, I have to undo a year's worth of Trump's messaging downplaying this pandemic to now try to convince Republicans that the vaccine is safe. It's tougher now that Biden is president. He's not a messenger that a lot of Republicans are going to listen to. And if you go on conservative media, you can find lots of conspiracy theories being pushed about the companies behind this, about Bill Gates. And so there's a lot of skepticism, and the concern among public health officials is that what was this once kind of fringe anti-vax conspiracy theory has now blossomed into a partisan issue that will just make it much harder to contain. And you have those polls showing 41% of Republicans saying they won't get vaccinated. Other polls have backed that up, showing that not only are they hesitant, but they're outright opposed, which is different from some other groups like African Americans and Latinos, where you have more people wanting to take a wait and see approach. And it's all about trying to get to herd immunity, which is when enough people get vaccinated that the virus can no longer spread on its own and mutate on its own. We don't know exactly what that number is, but the estimates now are around 80% of Americans. So if a quarter or half of Republicans don't get vaccinated, it's going to be really tough for us to reach that 80% threshold.
Alex, Dr. Fauci said it would be a game changer if former President Trump told his supporters to get the vaccine. Take a listen.
If he came out and said, go and get vaccinated, it's really important for your health, the health of your family, and the health of the country, it seems absolutely inevitable that the vast majority of people who are his close followers would listen to him. He's such a strongly popular person. I cannot imagine that if he comes out that they would not get vaccinated. It would be very helpful to the effort for that to happen.
But, Alex, President Biden said today that local health care providers and religious leaders will have the biggest impact. What's your take here based on your reporting? Which is it?
Yeah, so there's a lot of research going back years with other vaccines that one-on-one conversations with doctors and trusted community leaders are, in fact, the most effective way to convince people who are hesitant about vaccines to get vaccinated. So Biden is right there. But of course, that's a very slow, painstaking process. You're talking about one-on-one conversations with millions of Americans. And, you know, we need to tackle this right now. So the experts that I've spoken to say you need to do all of the above at once. And Trump indeed would go a long way towards reassuring people. But he hasn't done that. He got vaccinated himself, along with former First Lady Melania Trump, before they left the White House. But they did it secretly. There were no photographers, no videographers present. We only found out about it months later when the New York Times reported it. People I spoke to said that they would love for him to have posted about that, to share that, tell his supporters. He has a long history of kind of flirting with these anti-vaccine conspiracy theories. And it's especially strange because it was his administration, and of course, that helped develop this vaccine. So there's a lot of even Republicans who are quietly and some more publicly are saying, come on, former President Trump, you could take credit for this. You could be on the road taking a victory lap. But he's not really doing that. He was the only former president who is still alive who did not participate in this new ad campaign to encourage people to get vaccinated. And his only message about vaccines since he left the White House was to tell people, to remind people that he was responsible for it. But he didn't say anything about, you know, go get vaccinated or it's safe, it's effective, go out and do it.
So, Alex, what is the Biden administration doing to try and get the skeptics in particular vaccinated?
So this is a tough issue, Allison, for them because they know that they are not going to be the best messenger here. You know, Republicans are not going to listen to President Biden. But on the other hand, they want to get everyone vaccinated, not just for altruistic reasons, but because if the economy is going to get back, if he is going to be a successful president, he needs for us to reach herd immunity. So they've been having conversations with evangelical leaders, with rural stakeholders to try to increase awareness. They are looking to engage with people like country music stars and other people who have more credibility in these communities. They're going to be rolling out a campaign on that sometime soon. And so they have started doing some outreach on the director of the NIH is a man of faith, and he has gone on the 700 Club and other Christian broadcasting network stars. But what's going to ultimately, hopefully, do this is millions of dollars of advertising and then better access in these rural areas, and then just that slow whittling away of people's concerns as they see their friends and getting vaccinated and they see it safe and have those conversations with their doctors.
All right, Alex Seitzwald, great to have you on News Now. Thank you so much.
Thanks, Allison.
Florida residents 60 and up can now get the COVID vaccine, the state lowering its requirements starting today. Vaccine eligibility has been a little bit confusing in Florida so far. NBC News correspondent Sam Brock is at a mass vaccination site run by FEMA in Miami to explain.
The state of Florida, Allison, good afternoon, coming into today, had 4.3 million people who had already at least received one dose of a vaccine, another 2.3 who are fully vaccinated. Given the fact that Florida is only a state with a population of about 21 or 22 million, it's a significant percentage. What you're looking at over my shoulder right now is lines of people coming out here as another bracket has been released, the 60 to 64 crowd. That's actually about 1.5 million to 2 million people now eligible again. Governor Ron DeSantis, at this point, he's hoping to be able to roll that back even further to people 55 to 60 in the coming weeks, maybe everybody at some point within the next month in April. But that depends on two things: the supply, whether the floodgates open, and of course the demand. The demand at this federal site here, a federally assisted site, has been strong all day. They were at 1,100 people vaccinated through 11 o'clock in the morning. They have the capacity, Allison, to do 3,000 people a day. In the tents over my shoulder, there are 40 vaccine stations that can be running simultaneously. So the infrastructure is there. The question is, are people ready right now? We interviewed one woman who told us that she really wanted to get the vaccine to help her family, but was concerned about the side effects. It was a difficult decision for her. How are you feeling about it?
Good, happy and nervous at the same time, like a mix of feelings.
Why a mix of feelings?
Anxiety, because I think that I'm protecting myself and my family, and I can see my mom, my aunt, but a little bit worried about the side effects and long-term.
We are quickly approaching 2 million cases of COVID-19 in the state of Florida. More than 32,000 people have died from this virus. If you're going to take some glimmer of good news out of that, it's the fact that the state had reported 31 deaths on Sunday, which, according to the Miami Herald, is the lowest single daily total we've seen since the middle of November. So hopefully the vaccines and people heeding social distancing guidelines will start to make a difference. It's the latest here in Miami. Sam Brock, NBC News. Allison, back to you.
Only 11.5% of the U.S. is fully vaccinated right now. But today, Dr. Fauci said, stop focusing so much on the numbers. Let's just get as many people vaccinated as quickly as we can.
We should not get so fixated on this elusive number of herd immunity. We should just be concerned about getting as many people vaccinated as quickly as we possibly can. And every day that goes by now, with more than 2 million doses going into people, we're getting closer and closer to control of this pandemic.
I want to bring in Dr. Elizabeth Claiborne, emergency medicine physician and adjunct assistant professor of emergency medicine at the University of Maryland. Dr. Claiborne, thank you so much for being with us. Do you agree with Dr. Fauci? Should we be worrying less so about herd immunity and more about just getting folks vaccinated as quickly as we can?
Absolutely. I think that's an important message to listen to. It's an elusive number because herd immunity is something that we're not sure when we're going to reach. And it's something that might be a moving target. And so the focus right now is getting as many people vaccinated as quickly as possible so that we can suppress the spread of potential variants, get this virus under control, and control the number of people who are actually getting sick and hospitalized. That's what causes our systems to be overrun. And that is why we have been shutting down in the past. So the focus really should be paying attention to, when am I eligible to get a vaccine? Where can I get that vaccine? And am I prepared to take action when my time comes up?
Most people who needed a second dose of a COVID vaccine have received that shot on time, according to a CDC report out today. But researchers are warning that might slip as more people become vaccine eligible. How important is it that people getting a 2-shot vaccine get both doses on time? And is there some wiggle room that we can work with here?
You know, I was pleasantly surprised to see the numbers that were coming out that shows that the majority of people were getting their second dose. Less than 5% did not follow up in the appropriate interval, getting the second administration of the vaccine. And that is important. That's how the vaccine studies were conducted, and so that is how they should be administered. Now, if you have the Johnson & Johnson vaccine and you're somebody who doesn't want to deal with the follow-up period, that might be a great option for you, and that's why the J&J vaccine is something that's going to really open up the ability to vaccinate other people in places that might be harder to reach and still protect you from death and severe disease, which is most important. So I do think it's extremely important to still stay vigilant with all the things you're doing to protect yourself before you get the vaccine, and to take the vaccine as directed, meaning both doses.
CDC Director Dr. Rochelle Walensky warned at today's briefing that the UK COVID variant could still take hold here. Take a listen.
In some states, Florida and California, it's up to 25%. In other states, it's lower. Our current models still project, but by the end of March, early April, B.1.1.7 will be the dominant variant.
Europe is seeing another COVID surge right now. Are we vaccinating fast enough here in the United States to keep new strains at bay?
We could be vaccinating fast enough to keep the new strains under control, but that is if we still implement all the other protective measures that prevent the spread for people who are not vaccinated. So the spring break gatherings, the traveling, I know everyone has pandemic fatigue, but we are so close to the finish line. And if we give up now and people stop being careful, no matter how quickly we vaccinate, if people don't do the other measures of masking and social distancing, then there's a possibility that we will lose control of this pandemic again. So that's why it is so important that we stay vigilant, stay masked up, and get vaccinated as quickly as possible. I do think that the end is in sight, but that finish line will continue to be pushed out if people lose patience and don't stick to the measures that all the public health officials are encouraging at this time.
You mentioned some of the important safety measures that we need to stick with. The U.S. has lost more people to COVID than any other country. What can we do at this point, other than masking, getting the vaccine, to help curb some of the most devastating numbers, the deaths that we are still seeing a year into the pandemic? Are there particular activities that you say, please reconsider, please do not do this? We are concerned that this really could be contributing in major ways to the problem.
Thank you for asking such an important question. And as an emergency physician, I just have to share with everyone that I still see tragedies taking place every day when I go into work. I am still seeing people die from COVID-19. I'm seeing families ravaged by this. And so one of the things I always advocate for everyone to do is to look at filling out an advance directive and emphasizing the importance of advanced care planning. No one that I've taken care of in the ED told me, yes, I expected to be here, Dr. Claiborne, today. I expected to get sick. And the majority of them that were very sick could not even speak for themselves. And that puts me in a difficult position as an emergency physician who has to make quick decisions that could determine what happens to an individual in the first minutes of them arriving. And so having access to what their wishes are, their past medical history, who to speak to, those are important things for me to have. It is something that I think everyone should be doing. I recently did a TEDx talk on this. So if you're interested in where to get these resources, how to fill out forms, I urge you to look that up, discuss it with your family and your medical providers, and do it now before an emergency or an illness strikes you.
These are tough conversations for people and families to have, I know, but as you've said, really important ones. Dr. Claiborne, thank you so much for coming on News Now. We hope you'll come back again soon.
Thank you for having me.
The coronavirus pandemic hitting the Appalachian region of Tennessee and Virginia especially hard. Back in November, hospitals there were filled to the brink, but today the situation is much brighter. The ICUs have cleared out, the mobile morgues are gone. So what changed over these last few months? NBC News Now correspondent Dasha Burns has the story.
Come on. These ladies have been your therapists, huh?
Yeah, these were actually some of the first chickens that we got to have the animals and just to be completely different environment than what I'm experiencing at work, to be able to come home and just feel peace.
Could I try?
Yeah.
Allison Johnson is a nurse of 17 years and a mom of 2. She loves adding new animals to her family farm. It's a beautiful place full of life and light. But when we first met Allison and her fellow nurses, they were surrounded by death and darkness.
How often do you see patients pass away during your shifts?
Every day we have patients pass. Some days it's multiple patients in a shift.
Ballad Health is the hospital provider for 21 counties in the Appalachian Highlands of Tennessee and Virginia. It's a region plagued with poverty and poor health outcomes. It took a while for COVID to hit here, but when it did, it hit hard. We first visited the region on Thanksgiving Day. There are healthcare workers who are caring for patients who are fighting for their lives right now.
There's a sense of helplessness from the staff. We're exhausting all efforts, doing everything we can, and just still cannot save everyone.
They knew holiday gatherings would make things even worse, and they were right. When we came back about 2 weeks later, the holiday surge brought the positivity rate to 25% and brought nurses to the brink. ICUs were maxed out with the majority of patients on ventilators.
Are you putting patients on ventilators?
Yes.
What is that experience like?
It's awful. Honestly, it's really terrible. They will just hold your hand so tight. They don't want to let go. And a lot of times they want to have prayer while they still can.
The death rate here got so high, the hospital's morgue ran out of space, and they had to bring in a mobile unit to store bodies. But while this was all too real for the nurses, some community members were claiming the mobile morgue was fake.
Just this week, we have an ICU patient who came in extremely hypoxic, so his oxygen level was very low, and he was in complete disbelief that he had COVID or that he was as sick as he was.
Misinformation literally killing people, as medical experts told us that patients delayed coming to the hospital out of disbelief. And by the time they did come, it was often too late.
It's hard for me to describe to you what we feel every single day. And I wish I could. I wish you could see inside my heart and you could understand the struggle.
No, you're getting emotional right now.
I'm sorry. We need our community to support us. We need people to take this seriously and follow the guidelines.
3 months later, the message seems to have caught on.
It's been really great. We've seen a gradual decline in our COVID numbers. As of today, we have no ICU patients with COVID.
No ICU patients?
No ICU patients at all. And
is it the vaccines? Is it this conversation that you've been having with your community members about how real it is, telling your story of what you see? What do you think brought people around?
I think probably a combination of both. I mean, we started to see our decline really before a lot of people had been vaccinated.
This region now leads the state in vaccinations. 15% of residents are fully vaccinated in Washington County, home to Johnson City. For these nurses, it means relief and reflection.
While in my career, I have trained for some biohazard and contagious diseases training. We didn't have the emotional piece. Nobody had really prepared us for death tolls and isolation from families, but we overcame it.
You knew what you were walking into every day. How did you keep waking up every morning and doing it again?
The support of my family was huge. Even though they didn't know how intense and the severity of things, they knew what I was doing was important, and they just kept encouraging me too. And I think my faith and just feeling that God had placed me where I needed to be.
What does your mom tell you about her job? What do you think she does?
That she helps save lives.
There's been so much loss in all of this. Do you think there's anything you all have gained as a family out of it too, though?
I think quality time together. I really hope as a family that we stay as close as we've become over this past year.
A group of House Republicans touring a migrant facility in El Paso, Texas today. House Minority Leader Kevin McCarthy calling the number of unaccompanied children crossing the southern border human heartbreak.
When we walked those facilities and we looked in those rooms that were packed, these were children with no parents. These were children that went numbers of days. Who knows what happened to them? Who knows who didn't make it?
NBC News Capitol Hill correspondent Garrett Hake joining me now from El Paso, Texas. Garrett, Republicans are calling this Biden's border crisis. Right now, the president is under mounting pressure from Republicans and Democrats to fix this. But it's also an issue he partly inherited from the Trump administration's policies. So why is he coming under fire for this 2 months into his presidency?
Well, there's a lot going on here. There was a backlog of asylum seekers waiting to get into the United States really since the waning days of the Trump administration and the policies put in place both to force migrants to wait in Mexico while their asylum cases were pending and to ban all refugees or would-be refugees during the COVID-19 crisis. At the beginning days of his presidency, President Biden said we're going to allow the unaccompanied minors who have come to get into this country and set aside those pandemic restrictions, and come they have at rates that are set to break records if they continue through the summer. Now, McCarthy and the House Republicans who are down here are making, in part, a political statement, trying to place blame for this surge in migrants on the Biden administration. But I really pressed McCarthy in our interview to define for me what he sees as the crisis here, and I think his answer was instructive.
The crisis is the presidential policy change, taking away the PACER, taking away the asylum, staying within Mexico to come over. And the first thing the president said that he was going to make 11 million people legal. When we sat and talked to a family from Honduras, we asked them how long they've been trekking. 22 days. Why was it 22 days? Because 30 days ago they heard President Biden say something that they thought now was the time.
So that is what Republicans argue the draw that is bringing some of these people here. It sets aside all of the other push factors from these migrants' home countries, the poverty, the hurricanes, the COVID crisis in those countries. But it is instructive for seeing how a significant portion of this country looks at the crisis that is developing here along the border, and increasingly in all of the places that these migrants have to be sheltered while their cases are worked out.
Garrett, back in D.C., the House is preparing to debate and vote on 2 immigration bills this week. Could you tell us what's in them, and will they help with the current problem at the border?
So neither of these bills will help with the problem at the border. In fact, they're probably the 2 least border-focused pieces of immigration reform you could imagine in an immigration reform setting. What these bills will do, one will provide a pathway to citizenship for the Dreamers, is widely popular on a bipartisan basis on Capitol Hill, should pass. The other is a bill that would provide a pathway to legal status for farm workers, very necessary in rural communities that depend on migrant workers coming across the border. These elements were broken off of the proposed, more comprehensive Biden immigration plan, in part because they are thought to be more popular. They are thought to be easier to pass. The challenges for stopping the crisis here at the border, particularly these unaccompanied minors, are much more complicated, and there's no obvious legislative solution in the hopper at all, Allison.
So, Garrett, overall, and this may be a tough question to answer, but how do lawmakers see the issues at the border? Do they consider this a political problem? Do they consider it a humanitarian one? Do they consider it a bit of both? And I know I ask you this often, but does it depend on whom you ask?
Yeah, look, I think both parties see this as both a humanitarian problem and a political problem. And I think you could argue there's a spectrum of how much one group might look at it politically and one group might look at it on a humanitarian basis. The problem isn't that they see the problem in different ways. It's that they see the solutions in such different ways. Republicans very much want to go back to the Trump era restrictions here, not allowing people into at the border, refugees or not, children or not, make it clear that folks aren't welcome, complete the border wall, and essentially try to say, do not come, you will not be allowed. Democrats say these people are facing incredibly destitute situations. If we just say you're out of luck in the desert on the Mexico side of the border, that's inhumane. Democrats, by and large, would like to bring these people into the country, let them go through the asylum process here in the United States. Both of these policies deal with the humanitarian issue in a different way. The Democratic policy essentially brings the humanitarian problem into the United States and says this is for us to solve. The Republican approach takes the humanitarian issue and says this is for y'all to solve on the other side of that fence, wherever it may be. And that's why I think this is such a difficult problem to bridge in a very divided country and in a narrowly divided government.
Garrett, you did such a great job of explaining just how both sides aren't seeing eye to eye on this one. Thank you so much for your reporting today from El Paso.
Thanks, Allison.
NBC News Now correspondent Dasha Burns is outside a border facility in Donna, Texas. Dasha, this facility designed to detain families with children for pretty short periods of time, but many of those kids are being held longer than the 72-hour legal limit. Tell us what you've been seeing there, how those children are doing. And I guess I should have said what you're able to see there, because I know it has been, in some cases, difficult to get a sense of what's going on.
Yeah, Allison, that's exactly right. And as you heard from Garrett there, this is a major test for the Biden administration, which has said that they want to create a more humane immigration policy. But the reality on the ground here, what we're hearing from sources is that right now we're still pretty far from that, especially at facilities like this one behind me here. This was set up in order to try to deal with the surge in unaccompanied minors arriving at the border. But right now, they are struggling to keep up with these numbers. And what we're hearing from the lawyers that we've been talking to who have had access to some of the children here is that this is incredibly overcrowded. They're saying that significantly more children, more people are in this facility right now than it was built for. It was built for about 250 people. But the lawyers we've been in touch with say from what they are hearing and what they are learning, it's many more times that. But the reality is right now we don't know a whole lot about exactly what's going on in there. No one has actually been able to look inside, including the lawyers who interviewed those children. They talked to them outside of the facility. We've asked for access. We haven't been granted that yet. We also did ask for some specific numbers from Customs and Border Patrol. We haven't received those yet either. But the lawyers that spoke to the children say that the conditions are not great. They say to the children were unanimously distressed and upset. They met kids as young as 1 and as old as 17. They were all concerned, confused about when they were going to get out. They say all night they hear children crying. They have very little access to outdoors time. Some of them say they hardly ever get to see the sun. We also spoke to the mother of a 4-year-old girl who was detained here, who said that she was crying on a 20-minute phone call, couldn't really make words. Her mother was terrified about what the conditions actually were. So there are no easy solutions here, Allison, but it does seem to be very difficult for these facilities to keep up with these numbers.
Oh, Dasha, it just tears at your heart when you hear about kids crying and their families having no idea what's going on with them. Dasha Burns, thanks so much for your reporting, my friend.
Thank you, Allison.
The Senate set to vote today on Deb Haaland's nomination to be the next Interior Secretary. If confirmed, she will be the first Native American cabinet member in our nation's history. It's a moment activists call a new chapter that is long overdue. Joining me now, NBC News national political reporter Sahil Kapoor and NBC News political reporter Vaughn Hilliard, who's in Albuquerque, New Mexico, which is part of Haaland's district. Vaughn, we'll start with you. You've been speaking with Native American leaders about today's vote. What are they saying about the significance of seeing Haaland in the cabinet?
Yeah, in fact, I want to just say right off the top here, I was just listening because the confirmation vote, Allison, just began literally about 60 seconds ago. So within just a couple minutes here, we should get final word that Deb Haaland is going to be the first ever Native American to serve in a White House cabinet as secretary. This is significant here because every single Democrat has suggested that they were going to vote yes on this final confirmation vote, as well as at least 2 Republicans, Lisa Murkowski and Susan Collins here. But when we're talking about the Native community at large, there's more than 5 million individuals in the United States, mainland United States today, who consider themselves American Indian or Alaska Natives. And when you're talking about Deb Haaland, you have to talk about the history that led us here, in the fact that centuries in which the American government has executed thousands of indigenous individuals, displaced hundreds of thousands of others, moving them off of fertile land, their homes, and even more recently, in the last century, forcing them into cultural assimilation here. This is a reality that Deb Haaland's own family lived through. She considers herself a 35th generation New Mexican. Her family on her mother's side, ancestors coming here to this area in the late 1200s. Deb Haaland is a member of the Laguna Puebla tribe, and for her, she grew up over the course of summers. She said that she understood what this means and the Earth's resources by watching her father farm the cornfields just down the road from here, and her mother cook and take part in traditional ceremonies. And I want to let you hear from Crystal Echo Hawk here from Illuminative here. Talk about the significance of seeing Deb Haaland's ascension here.
You know, I get emotional when I think about it. I get choked up because, you know, for Native peoples, you know, it's so much emotion. It is happiness. It is a watershed moment for our people because every day, you know, we wake up and we have to contend with so much the manifestations of systemic racism for oftentimes being largely invisible in this country. And when we do show up, oftentimes it's only as caricatures and stereotypes, as mascots, you know, and so for Native peoples, you know, this is a moment that is transformational.
Of course, Deb Haaland was first elected to Congress in 2018. She just won her second reelection. Her nomination by the Joe Biden administration to this post, as you just heard, is significant for the Native American community here in 2021.
So, Sahil, as we just heard from Vaughn there, the vote just getting started. What are you watching for in this vote? Which senators are you expecting to vote no here?
Allison, Vaughn is, of course, correct. The Senate is voting as we speak on the Deb Haaland nomination, poised to make history because the Democratic caucus is united in favor of confirming her to be Interior Secretary. That means all 50 Democrats are on board. When the Senate teed up her vote in the procedural vote last week to bring this up, 4 Republicans voted for her. That's Susan Collins, Lindsey Graham, Lisa Murkowski, and Dan Sullivan. The last 2 are senators from Alaska. Both of them are Republicans. And it's very interesting to see the kind of unanimity in Alaska behind Deb Haaland. One of her biggest supporters was Don Young, the long-serving Republican congressman from Alaska. So the question is she going to be confirmed by 54 votes in the Senate, or are potentially 1 or 2 of those Republicans going to peel off? Either way, she will become the next Interior Secretary.
Vaughn, you've told us a bit already about Deb Haaland's background. You're not too far from a reservation where she spent summers with her grandparents. Could you tell us a little bit more about that and how her background and time there will serve her as Interior Minister? We know it is so significant for folks there in New Mexico for Native populations, but how will it also inform her job?
Exactly, and I think it's important to understand the role of Secretary of the Interior Department here. Not only does the Interior Department oversee 20% of the land here in the United States, but it is also charged with maintaining relations with the 574 federally recognized Indian nations here. And that is why when you talk, Deb Haaland has talked herself about this here, but to actually have a Native individual at the helm involved in those conversations is significant because there's often overlap between tribal communities as well as other federal agencies like the National Forest Service, the Park Service. I was talking with a newly elected Pima County recorder in the Tucson area. I just got off the phone with her, Gabby Cazares Kelly, and she was telling me she has never met Deb Haaland, but refers to her as Auntie Deb. And she said, for somebody to be called Auntie, that is a sign of endearment, of respect. She goes, all across this country here, there are young people like her, including those like her in public office, that are looking to Deb Haaland now, about to join the Joe Biden administration.
All right, Vaughn Hilliard, Sahil Kapoor, thank you both so much for being with us. In Texas, Republican state lawmakers are introducing more than 24 bills targeting early voting. NBCNews.com senior reporter Jane Tim explains how this legislation could drastically change election laws there.
Republicans in Texas have rolled out a spate of new election bills taking particular aim at early voting after Democrats enthusiastically embraced the practice last year. There are now more than 24 GOP-sponsored election bills under consideration. Republicans have proposed asking mail voters to send in photocopies of their driver's license and adding civil penalties to election officials who don't purge voter rolls fast enough. There's broad interest in these bills from the party and a mandate from the state's Republican Governor Greg Abbott as well.
We must pass laws to prevent election officials from jeopardizing the election process. We also must ensure transparency in the polls.
Now, many of these bills target early voting, and in particular, early voting in Harris County, where creative officials deployed drive-through early voting to keep things socially distanced and overnight early voting to make it easier for shift workers to cast a ballot. Now, Republicans have proposed barring counties from allowing voting in tents or garages, that would effectively end drive-through voting, and limiting early voting hours to stop those overnight ballots. Some proposals standardize early voting hours across the state. That means that Loving County, Texas, with a population of around 200 people, would have the same early voting hours of operation, 7 to 7, as Harris County, home to Houston and 4.7 million people. The proposals would limit options in urban areas where Democrats typically live. I asked lawmakers why this is such a priority now, and here's what the chairman of the Senate State Affairs Committee told me.
So Texas has been working on election integrity for a while. So this was already in process. But then the 2020 election, was so in the national spotlight, and so many people have questions, so many people have concerns. I would say that has raised the profile of the issue.
Now, let's be clear. There was no widespread voter fraud in the 2020 election. And that concern Senator Hughes refers to was largely drummed up by former President Donald Trump, whose stolen election claim convinced many voters that voter fraud exists, despite the lack of evidence. Now, Hughes told me he doesn't even know if the presidential election was stolen or not, even though he was elected in 2020 as well. Texas is not alone. It's one of 43 states considering hundreds of restrictive voting bills across the country, and many of the restrictions are really similar. Georgia is also considering standardizing early voting hours across the state, something that would have a similar effect on those urban areas where Democrats vote. Now, it's important to note that voting restrictions like these disproportionately impact voters of color. Voting rights advocates say Texas, which saw record turnout in 2020, should be doubling down to make it easier to vote, not more restrictions that would roll back some of these innovations that helped turn voters out.
A Pennsylvania mother charged with harassing girls on her daughter's cheerleading team, allegedly making deepfake videos of at least one of the girls. The district attorney on this case said this about deepfakes earlier today.
I'm not saying that they're not funny or humorous on TikTok. I know we've all laughed at them. But where it crosses the line into criminal conduct, and certainly when an adult is seeking to victimize children, that's where law enforcement gets involved.
NBC News correspondent Stephanie Gosk has more on this alleged cyberbullying.
It's a troubling new take on cyberbullying. A mom in Pennsylvania is accused this morning of using so-called deep fakes to anonymously harass members of her daughter's cheerleading team.
I think I was just so much in shock with everything going on. I couldn't really comprehend what was going on.
Maddie Heim says after getting several threatening calls and texts from unknown numbers, some even saying she should take her own life, her cheer coaches told Maddie they received this video that supposedly showed her vaping. She and her mom shared it with us. They say it's fake.
I felt like if I said to someone, no one would trust me. They have the video on proof, even though the video wasn't real.
According to court documents, images from Maddie's social media were also doctored to make it appear like she was nude and drinking. Her mother turned to police.
I didn't know how to protect her from that. I didn't know who to protect her from. There were a lot of sleepless nights.
Authorities say behind it all was Rafaela Spone, whose own daughter is a teammate of Himes on the Victory Vipers cheer squad. Spone is now charged with 3 counts each of cyber harassment of a child and harassment.
My client denies what they have charged her with.
and we are going to aggressively fight this.
In a statement, the Victory Vipers said, in part, their group has always promoted a family environment, and we are sorry for all individuals involved. Deep fakes have made headlines before with manipulated videos, like this one showing what appears to be Tom Cruise.
It's the real thing.
But they're not real. They're altered through software. The district attorney in Pennsylvania fears this is the start of a dangerous trend.
But we've always taken for granted that a photo is a photo, a video is a video. We can't take that for granted any longer.
A disturbing new tool that has this community demanding justice.
It is the end of an era in New Orleans. Saints quarterback Drew Brees announcing his retirement after 20 seasons in the NFL, the last 15 of them with the Saints. Brees showed up just after Hurricane Katrina devastated the city and eventually led the team to a Super Bowl championship. Brees spoke exclusively with Today Show co-host and Saints superfan Hoda Kotb just hours after his announcement.
I'm 42 years old. I've had a chance to play this game for 20 years in the NFL. And I think for the last few years, I felt like this moment was coming. And it just made me so laser focused on staying in the moment each and every day.
Here's NBC News correspondent Morgan Chesky with a look back at the legacy Brees leaves behind.
Allison, just an incredible career no matter how you look at it. And a very cool full circle moment yesterday when Drew made this announcement exactly 15 years to the day that he became a New Orleans Saint. Since then, he has made this city his home. And he leaves a legacy that few here or in the NFL can match. It's official. Legendary Saints quarterback Drew Brees announcing his retirement after a historic career in the NFL.
Tonight, it's about us! It's about us!
Sharing the news with a sweet video message from his kids.
After 15 years in the Saints and 20 years in the NFL, our dad is finally going to retire. So we can spend more time with us. Yay!
The 42-year-old great saying goodbye after 20 seasons, a record 80,000 passing yards, and a Super Bowl championship.
And Brees fires, and that's caught.
Tributes pouring in. The Saints tweeting, "You came to us at our lowest point. You led us to our highest." Tom Brady tweeting, "Congrats, my friend, on an incredible career." The two NFL legends sharing this quiet moment on the field after this year's NFC Championship and what we now know is Brees' final NFL game. Brady even throwing a touchdown pass to one of Brees' kids. Brees' NFL career started with the Chargers back in 2001, but it was during his 15 seasons with the Saints that his legacy took shape. He signed with the team in 2006 when New Orleans was still reeling after Hurricane Katrina.
I'm going to do whatever it takes to get me back as fast as possible.
Brees coming off a career-threatening shoulder injury, but the resilient player and the city that adopted him found success together. In 2010, he led the franchise to its first and only Super Bowl championship.
We played for so much more than just ourselves. We played for our city.
But it hasn't been a perfect ride. Last year, Brees apologized after calling kneeling during the national anthem disrespectful, saying his comments lacked awareness.
And Brees now under pressure throws, and that'll convert.
Across his impressive career, Brees won the respect of fans all across the country and always had a fan in Studio 1A.
Oh, yeah.
Surprise.
I'm wearing your number 9. Hey, I just want you to know I got your jersey.
We know where Hoda's loyalties are, and we love
That's
it.
right.
She's
Absolutely.
a New Orleans girl.
Last year, after COVID hit Louisiana especially hard, Brees and his wife Brittany did what they could to help.
You let us know that you made this big, generous donation. I think other people look and say, hey, maybe I can help out too. Drew, we love you.
Love you too, Hoda.
Okay.
Thank you.
All right, a lot more.
Earlier this year, after what would become his final game as a player, Brees took a moment as he walked off his home field.
Man, I've always tried to play this game with a great respect and a great reverence for it.
Reverence and respect now being returned to the player who forever changed the game. And even though Drew is stepping off the field, he'll stay very close to the game that he loves. We've recently learned that Drew has signed a contract with NBC Sports, so he'll be calling games with the best of them. Allison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.